Welcome to another video from my website, trustedmedicareadvice.com. My name is Philip Alston. I'm a pharmacist as well as an independent insurance agent. My goal here, as always, is to help you learn about Medicare. Once you understand how Medicare works, we can work together to find plans to match your health needs, your lifestyle, and your budget. I'm located in northeastern Broward County, Florida, just south of Boca Raton, and I'm also licensed in the states of Georgia, Illinois, and New Jersey. The topic of today's video is Medicare Prescription Drug Plans, Part D. Medicare Part D prescription drug plans are additional insurance policies that help to cover the cost of prescription drugs. These plans are offered by private insurance companies that are authorized, regulated, and subsidized by Medicare to sell Part D insurance coverage. Each plan is a one-year-long, annually renewable contract. Part D plans require a monthly premium that varies by plan and company. Each Part D plan can have a different formulary. A formulary is the list of covered drugs. All Medicare drug plans generally must cover at least 2 drugs per drug category, but the plan decides which drugs they will offer. Within a plan's formulary, the drugs are divided into tiers. Tiers are based on drug cost. There may be 4 or 5 tiers in a plan, and generally tiers 1 and 2 are the lowest cost drugs for the member, with tiers 3, 4, and 5 getting progressively more expensive. When you enroll in a Part D drug plan, in addition to the premium, you are responsible for paying your deductible and copayment amounts. Medicare sets the maximum deductible each year. For year 2022, the maximum deductible is $480. However, the insurance companies can design their plans with deductibles that range from $0 up to the annual maximum allowed by Medicare for that year. Each insurance company may offer multiple different plans, each one unique from the other. Different plans may also have different preferred pharmacies. Generally, your copayments will be lower when you fill your prescriptions at the plan's preferred pharmacies. With all these potential plan differences, there is, however, a common structure that the plans must follow. There are 4 phases or steps to the plan structure. Phase 1 is the deductible phase. Members pay the full cost of their drugs until they meet their deductible. Phase 2 is the initial coverage phase. Members pay a copay for their prescriptions and the plan pays the balance. This phase continues until a certain dollar amount is reached, called the initial coverage limit, or ICL. The ICL is based on the total retail value of your prescription drug purchases, which includes what the member has paid as well as what the plan has paid towards the drug costs. For year 2022, Medicare has set the ICL at $4,430. Phase 3 is the coverage gap phase, also known as the donut hole. Once the ICL has been met, the coverage gap phase begins. In this phase, members pay 25% of the cost of either brand or generic drugs. Brand drug manufacturers pay 70%, and the plan pays the rest. Members used to have to pay 100% of drug costs in this phase, hence the name donut hole. But now the donut hole is considered closed because the drug manufacturers are picking up such a large portion in this phase. Medicare uses the term troop to determine the upper limit of this phase. Troop includes what the member pays, plus what is paid for them by others, including brand drug manufacturers, as well as anyone else during this phase. However, it does not include what their prescription drug plan pays. For year 2022, the coverage gap phase limit is set at $7,050. Once that dollar amount is met, the next phase begins. Phase 4 is the catastrophic coverage phase. Members pay $9.85 for brand name drugs and $3.95 for generics, or 5% of the drug cost, whichever is greater. Most people never get past Phase 2, the initial coverage phase. but the other two phases, coverage gap and catastrophic coverage, are there to protect those on very expensive medications. Note that there is no limit on prescription drug out-of-pocket costs. MOOPs, or maximum out-of-pocket limits in Medicare Advantage plans, have nothing to do with your Part D prescription drug costs. Because Medicare Part D prescription drug plans are one-year contracts, plans can and often do have changes from year to year. A plan can make changes to its deductible, copays, formulary, tier structure, as well as the pharmacy providers. Pharmacies can be added to the plan, removed from the plan, or changed from preferred to standard or from standard to preferred. Be sure to always review the annual notice of change. Medicare requires each plan to provide its members with an annual notice of change, or ANOC. These notices arrive in September to give members time to review the changes and to determine whether their plan will still meet their needs in the following year. Members get an opportunity to make changes, if they wish, during the annual enrollment period, or AEP, sometimes called annual election period, which goes from October 15th to December 7th each year. Any changes made during AEP will go into effect as of January 1st of the coming year. With Part D prescription drug plans, there are strict rules governing when you can purchase, leave, or change a plan. If you don't purchase a Part D plan when you first become eligible to do so, you may be charged a late enrollment penalty when you try to buy one later. You'll generally have to pay the penalty for as long as you have Medicare Part D prescription drug coverage. This penalty can be avoided if you have creditable drug coverage from another source, such as VA drug benefits or drug coverage through an employer group health plan. Always check with your benefits administrator or HR department as to whether your prescription drug coverage is creditable for Medicare. And also be sure to save any notice of creditable coverage that you receive from your employer or employers. You may need that as proof if you go to sign up for a plan in the future. Thank you again for watching. And if you enjoyed this video, as always, please remember to give it a thumbs up. That helps other people find it as well. For those of you new to Medicare, I've got a quick reference guide called It's Time to Learn About Medicare. If you'd like to get a copy, or if you need help with Medicare plans, give me a call at 1-800-492-1163. Or you can email me at trustedmedicareadvice@gmail.com. And don't forget to visit my website for lots more information. The website is trustedmedicareadvice.com. Thank you again.